Welcome everyone. Thank you for joining us on this Friday afternoon. It's certainly lovely weather in London. I hope it is where you are too. But thank you for taking time out of your busy schedules to take part in this webinar. This is a webinar run by the What Works Centre for Children's Social Care Development Team, and it's an opportunity for all of you to hear a bit more about our call for partners to work with us on the co-development, testing and development of a range of promising approaches around the generation and sharing of evidence. So we think it's a really exciting opportunity to shape the way we intend to work with the sector over the coming years. So thank you again for taking the time out to do that. The agenda that, so just to introduce myself, I'm Ewan King from the Social Care Institute for Excellence and also the engagement lead for the What Works Centre Children's Social Care Development Team. And the plan today is to start off with an introduction to the call for partners, and we're going to hear from my colleague Greg Wilkinson, who's the Programme Director for the What Works Centre, and my colleague Damien Gilchrist, who is the Programme Manager for the What Works Centre. They're going to tell you a bit more about the call for partners opportunity, what we're looking for, and how the process of applications will work. And then we're going to, that's going to last about 15 minutes, and then we're going to take questions for 30 to 40 minutes. We'll see how we do, and hopefully be able to answer most of your questions on the webinar. So we can see your questions, so if you start sending them through when they spring into your head, we can see them, we can start collating them at this end and make sure that we have answers for you once you send those, once we stop the presentation. If we can't answer your questions today, we will endeavour to get back to you with answers as soon as possible early next week, if is the plan. I'm going to hand over now to Greg, who's going to take you through the presentation.
Thanks, Ewan, and good afternoon, everybody. I've been working with different parts of the What Works network for a little under 4 years now. I first had contact with the Centre for Ageing Better. It was actually on the Saturday morning of the FA Cup final in 2014. And throughout that period, it's mostly been with Ageing Better and more recently with this initiative, the What Works Centre for Children's Social Care. I've had a quote in my mind that some of you may know. It's a quote from Karl Marx, which is that philosophers have hitherto only interpreted the world in various ways. The point is to change it. And that focus on the need to try and make sure that this initiative brings about changes is at the top of our list. It's at the top of the DFE's list as well as our paying client. There's a real recognition that, you know, for us to be successful, we have to help improve practice, and for that to feed through to improved outcomes for children, young people, and their families. We also know from a variety of sources across the What Works network that if we want to bring about that change, good evidence is a necessary but not sufficient condition of success. A number of the other What Works centres have wrestled with this problem, and it's pretty much a consensus that it's not enough to carry out a rigorous systematic review or run a great trial and produce a compelling written summary of that and put it on a website. If you want to bring about change, we can't assume that we can build something and everyone is going to come. So what else is necessary? Well, we have a theory about the other components that will go alongside good evidence, and it's probably identifying sort of 3 principal areas where we think additional conditions for success are required. The first is building the capability, motivation, and opportunity of practitioners, decision makers, and leaders to engage with and act on the evidence. The second is creating the right organisational and cultural conditions to support those factors. And the last is to try and find ways at all stages of the process of building a thoroughgoing involvement of professionals and practitioners in the work of these initiatives, rather than it being some kind of sort of tailored exercise where it is done to you. Now, those insights don't just come from the experience of other What Works centres and from academic research, particularly stuff that UCL has done. They also come from conversations that we've had across the sector. So we're reasonably confident that broadly that's the right take, but we need a lot more detail before we can say that we've got to the answer. this initiative is a startup, and so we are going to have to build the answer over time, and we think the best way to do that is in partnership with practitioners within the sector. And we think that if we can use, alongside that partnership way of working, design methods, rapid cycle testing, so that we can try out and iterate various tools and services, that's really the best way that we can construct an approach that's going to be successful and sustainable. And that's really where this call for partners comes from. As the first slide says, we're looking for people who are going to be comfortable working with us in this experimental, iterative way to develop. Sorry, I've got to pause. Guys, can you hear me now? Is that better? I'm going to assume that's a yes because I've had a thumbs up. We know that we want to find partner authorities that can work with us in this kind of spirit, and that we want to have those relationships working across the three core functions of the What Works Centre, of any What Works Centre that are highlighted on this first slide: generating better, more relevant evidence, sharing evidence via the most effective means, and also working to understand what it will take to scale the adoption of evidence-informed practice. So that's really where this is coming from. And if that sounds like it's potentially characterised by ambiguity, uncertainty, and quite a lot of sort of rapid change, then I think that's right. And one of the things that we want to convey in this call today is almost like how it's going to feel to work with us on this, and how it feels may not be right for everyone. So in addition to the factual questions that you've got, the more sort of almost kind of the softer questions about how we see this working is an important agenda for us to cover. And just to make things absolutely clear, as a result of that sort of slightly ambiguous, uncertain feel, there may well be questions that you raise on this call that we can't answer now, because genuinely we don't know what the answer is. We will do our best to answer the questions on the call now, and we'll do our best to get back to you within the next few days if we can't answer them today. But there's almost certainly going to be a set of questions at the end that we still need to work with. And that kind of ambiguity and uncertainty is what you'll be letting yourself in for if you sign up for this process and you're selected. But the upside of it is that there's a real opportunity to shape something that we hope will change the way the sector goes about its work, and for you as prospective partners to be really sort of present at the creation of this, that genuinely we want this to be established in partnership with you, because we think that's the best basis for bringing about long-term change. So that's the kind of sort of introductory, almost sort of philosophy feel for what we're trying to do. In terms of the detail of what we've got in mind, I'm going to hand over to Damien.
Okay, thanks for that. And I'm seeing a few comments on the screen that people can't see the slide pack. Is there anyone other than Mark struggling to see the slides? Because I'd like to be speaking to those. So I'm going to take just a few seconds. I can see a few people writing, but I'm going to assume we're good to go. So picking up where Greg left off, just with the sort of what we could almost see as probably the most simplistic theory of change that you'll see in a lifetime. The evidence plus supportive conditions equals change. It is sort of simplistic, and it is possibly almost ridiculously high level. But this is our starting point. We have two contracts. We have a research partner producing a range of evidence to support evidence-informed practice, and we have an incubator setting up the organisation and testing, innovating around new forms of business practice that can support the application of evidence in the real world, in the real environment. So I think it's probably quite sort of helpful just to start with that little equation in mind, and to know that we're focused on the second part of that equation. So I'll take us on to the second slide now, and hopefully you can all see that. So there are the three roles that Greg just referred to for the Future Centre, and these are very much reflective of other what works centres. So there's a role we just referred to in generating more and better evidence, and from our work with a range of local authorities and other stakeholders to date in our initial engagement activities, we've determined that there are probably two key questions here. There's one around generating more evidence, because there's so much practice that doesn't appear to have a sort of wealthy evidence base. And then there's a question about actually what is the quality of that evidence, and what is the quality standard that is applied to it. So we have a long list of things that we would like to do in this area. We've picked out two for each of these categories. So the first is a little example picking up on some work that social finance have been doing around creating a digital benchmarking tool specifically related to the 903 looked after children data set. So we have a proposition here to be working with social finance, perhaps in a different area, perhaps in that same data set, and we would like to explore whether there is some merit and some benefit to be had in working to improve that data set in perhaps new localities, perhaps towards a national benchmarking tool around data performance in that area. The second idea we've got here is a DIY self-evaluation. So this is a concept in which the partner organisations of the What Works Centre development team would work with the prototyping local authority to help them to set in place the conditions for a successful and more rigorous, more scientific evaluation of the local initiative that they have in train. In that second category, we have making evidence rather more relevant. So the two examples we pulled out are a prototype in which the What Works Centre development team would work with the local authority to co-generate some research evidence. And then the second is based on an idea from the healthcare arena called the James Lind Alliance, in which practitioners and users come together to determine what are the areas of practice, what are the areas of user experience where it's felt that it would be beneficial to generate more research. And we'd like to apply that to the children's social care context. So moving on to the next slide, sharing evidence more readily. Again, two subcategories to this. First, the accessibility of evidence, and then the skills, the capabilities on the ground to apply evidence. And a few examples for these we've picked out three. So the first is it's a very obvious one. This organisation, the What Works Centre, will need a website, and it will need some front face to the repository of evidence that it offers, which at this moment in time we're calling the evidence store, but elsewhere is called the toolkit. The examples to look at include EEF, EIF College of Policing. And we'd also like to prototype something around network learning, so using digital media, social media for particular communities of practice. And this could be inter-local authority or intra-local authority, but again, we want to develop that with our partner sites. And the final example here is helping people to use evidence well, and so this picks up on the Alliance for Useful Evidence's evidence masterclasses that have been successfully deployed in other sectors. And then, so moving on to that third and final role, they're scaling evidence insights. Two propositions here. One, to help develop the What Works Centre's outcomes framework, and two, to help develop a proposition around what we're calling the organisational development offer. So this is broadly the sort of culture change piece that would be offered to leaders in children's social care to enable them to build an evidence-informed social work organisation. So it's a little bit of an insight into the sorts of ideas that we're wanting to prototype. There's a much longer menu that, when it comes to it, and we have selected our 3 to 6 partners, we will want to go through that menu and actually determine which are the most attractive in each of the localities. So how does this all come together in practice? I hear you ask. So if you move on to the final slide, what we've done here is simply put the two parts of the equation together. So the evidence, the topics down the left, which we very often sometimes refer to as the what's, the practice areas, and across the top the hows. These are the prototypes themselves. So we are committed to 2 priority research areas, and more may come on stream in the coming months. The 2 areas that we're committed to are safely preventing children from entering care and supervision and decision making. We will also have a significant interest in workforce wellbeing at this stage, and doing some preliminary scoping around mechanisms and practice models at the front door. However, I think, as we said in the call for partner sites, we are interested to hear from applicants who wish to explore various of these prototypes in other areas, and we'd be keen to hear from you as to what you propose. Across the top, the prototypes that I just briefly introduced you to, running 1 to 8 under the headings generating, sharing and scaling. And then the final column there is again another, and we'd be keen to hear of any bright ideas for innovating around generating, sharing or scaling on the back of evidence-informed insights. So I hope that is a helpful little graphical presentation of what we're looking to do. The little blobs that you can see on the screen there, I hope you can see them more clearly than I can. Simply to say that these are local authorities. These are where the individual sites might operate. So, for instance, in the third column, we might have a local authority working on DIY self-evaluation of a particular initiative in workforce wellbeing, for instance. So that's a little introduction into how we conceive of the overall portfolio coming into play, and you'll see that each local authority on this diagram is involved in 2 or 3 prototypes, and that's broadly the sort of scale that we would be considering. But if there's an appetite for being involved in more, then that can be discussed. So the second thing I was going to talk about was just what it is we're looking for, and without wanting to repeat too much from what's in the partner site, so I was just going to pull out a few of the key principles. So we are looking for a range of organisations. We're looking to have some considerable diversity, as much as you can, across 3 to 6 local authorities, but assuming we go towards the top end, the 6, we are looking for a mix of district and borough, unitary, metropolitan, county authorities. We're looking for a range in terms of recent performance, and we're looking for good geographic coverage. We're also looking to have a sort of mix that isn't really biased towards the sort of usual suspects. So certainly not all partners in practice, and hopefully having sort of participated in a range of different initiatives recently, but there's certainly no requirement to have done so. We're also looking for partners to be flexible, to be comfortable with the ambiguity of this sort of subject matter. But above all, we're looking for motivation. So we really want to work with partners who are going to be enthused by working in an experimental, iterative way, and helping to set up this important initiative. So there's a little bit of an intro, and at that point, I think we're handing over to the MC for questions.
Okay, so
should we go in first one?
Yeah, so I've got 3 questions so far that have come through the feed. The first one is about how does this link, this initiative link to other established practice systems such as signs of safety. That's what I understood to SOS to me. The second question, are you looking for 6 organisations to be involved? Do you have any specific number in mind? And the third question was whether we would accept or welcome application from a group of local authorities working together. So I don't know if I can hand over initial responses to those questions. Greg,
so should we take these in reverse order?
Yeah.
So the final question: would you consider group applications? And the answer is absolutely yes. We're focused on innovation. This is primarily, first and foremost, an innovation initiative. So if it is your judgment that a group application would be attractive, and you have some good ideas within that, and if it would work for you, then we would like to hear from you. The second question: are you looking for 6 organisations to be involved? Do you have a specific number? The answer is no. So it could be 3 groups. Now that we're on the subject of groups, it could be local authorities bidding with a strategic partner, and that strategic partner could be another authority or a third party. We probably will limit the number of partners to 6, but
thereabouts, yeah.
But
so I mean, just to add to Damien's comments there, I came up with the original range of 3 to 6, and as you can probably sense from my earlier remarks, from the way I'm talking now, I'm not wedded to that. If there's a really compelling set of applications from 7 authorities, I'm not going to say there's a hard cut-off of 6 and we're just going to run a rigorous evaluation process and drop the other one off. We're genuinely interested to hear from you in response to this, and if there's a lot of appetite and we feel that we can work with a larger number of applications, then we will do that. Obviously, from our point of view, we're not a huge team, and we've got to be careful not to overcommit at this early stage, and to remember that the point of this is to do very early design work, and that for that to be effective, we probably need to keep it at a fairly small number. That doesn't mean that we won't be working with larger groups in future, but as I say, don't assume that 6 is the absolute limit. The last question, or the first question, was from Sheffield about how this links to other established practice systems. Well, I mean, it's designed both to be complementary with a range of practice systems, and also on occasions for some of these initiatives and activities to have as their focus either the practice system as a whole or aspects of the practice system. So I'm sure that one of the things that we will be looking at in the research priority about safely reducing the need for children to enter care will be the effectiveness of a variety of approaches. And I know that Donald has in mind from Cardiff and the research partner to undertake a systematic review of signs of safety as one of his early priorities. So I think it's both a series of activities that hopefully will complement your adoption of any particular practice system, and also potentially looking at that practice system and trying to develop more insight into whether it works, and if so, why and how it works, so that more information about some of those contextual and implementation factors can be shared with people. I have seen a question from Claire about whether, if they're one of the usual suspects out in practice, should we not bother to apply? Don't take Damien's comment as meaning that no partner in practice should apply, because we as he said, we want a range of authorities in our set of pioneer partners, and I would be absolutely amazed if at least some of those pioneer partners weren't partners in practice. In fact, I'd almost go as far as to say I would. I think it's possible. I think it would be highly unlikely. So we're interested in hearing from partners in practice and from non-partners in practice, but we're just sending a signal that we don't think that we will be selecting 6 partner in practice authorities to be our pioneer partners. I hope that's clear. If you want to follow up, you're welcome to do so. Next question, Ewan.
Okay, so there's a question about the local coordinator that we're intending to help fund to work with us, and someone asked a question about what their role would entail.
Do you want to start with that?
So yes, I can pick that up. So the local coordinator is intended as the single point of contact, both for sort of incoming communications from the authority and from the development team, to facilitate access, build and manage relationships either way, but also to fulfil both the sort of functional and management role in respect of organising the meetings and events, the sort of logistics, but also to co-develop the content. And there's a very sort of substantive role in the content, working in partnership with the prototyping team from the What Works Centre. So it's quite it's a sort of wide-ranging, quite hands-on, and we hope quite interesting, developmental and challenging role for the right person. It's probably not a principal social worker or the AD. It's not at that level, although it might be. That's something to be broken and discussed. But we envisage it to be more like an advanced practitioner or a senior practitioner. So the way we see this working in the round is that the principal social worker or the AD is likely to be the sort of senior responsible officer for the project. And the coordinator would probably report into either of those.
Okay.
Shall I pick up some of the questions that I can see on the screen? So I can see one from Linda and one from Andy and Sophie that look like they're speaking broadly to a similar line of thinking. We have got ideas, as you can see from the last slide there, and from the written material that we've circulated. But just to be clear, I don't think that we are wedded to any of them, apart from the principle that we want authorities who will work with us on the early research priorities around safely reducing the need for children to enter care and around supervision and decision making. So although all of the columns that we've got there are based on ideas that we've generated through conversations with the sector and also conversations with other What Works centres, if you as a collective group of applicants said none of those things feel like they're going to hit the spot in terms of generating, sharing and scaling evidence-based insight, but here are half a dozen initiatives or ideas that would, in our judgment, hit the spot, we would be very happy to talk to you about that. And as I was trying to explain in my opening remarks, there is something about this ambiguous, uncertain territory that is inherently open to negotiation and discussion. So what we're looking for is, and we put these out really as a kind of first set of thoughts, we're interested in your reactions, but if you said, actually, we want to submit an application based on the very last column of Damien's how activities, other, and the very last row of the very last row of the topics, we would still be interested in looking at that application, and if we thought that it was compelling and coming from a place of sympathy for what the What Works Centre was trying to achieve and creativity about how it might achieve that, then we would be open to including you within the mix. And so the only non-negotiable is that we need to have some coverage within our group of pioneer partners that is focused on the top two rows of the topics bit, i.e. the published research priorities. Is that enough on the question about other aspects of practice that you would like to test, Andy and Sophie, and also the question from, is it Linda earlier?
I think so,
That's
yeah.
good. Mark's asked a question there about the methodology for evaluating the effectiveness of the project, and I'm assuming that that's not the What Works Centre project as a whole, but you're actually talking about the effectiveness of the different components here. And my view is that in the first instance, the model of evaluation, the methodology, is very much one of our discussing it between us, the What Works Centre team and the local authority, and coming to a judgment about whether the approach or the concentration on the research topic looks like it's going to generate something promising and of value that warrants continuing development. Remember, what we're trying to do here is we're trying to develop a set of, if you like, products and services that will characterise the work of the What Works Centre as it increases its body of evidence and as we start to scale from the existing set of quite tightly focused relationships with a small number of authorities to working across the sector. So what we really want is a sense of, well, do we think that this approach to using a DIY self-evaluation approach might work if we offered it to a wider group of authorities? Here's a masterclass that we've tried with a couple of you. Did it fly, or did it feel like a bit of a waste of time? Here's a digital benchmarking tool. Can you actually use it to help you get better insight into the agenda around safely reducing the need for children's care, or is it actually not really very valuable? What does this first cut of a website taxonomy look like? What do these screenshots look like? What do these knowledge objects look like? Do they feel like the kind of things that you and your staff could work with? And actually, based on your feedback, we will iterate a set of solutions. And maybe the solution is, let's not bother with DIY self-evaluation, or let's not bother with this digital benchmarking tool. Let's do something else. So the success measure is through iterative discussion and almost rapid cycle testing, although I don't think we get that formal. Does it feel like this could form a useful part of the What Works Centre's armoury as it starts to scale up? And your judgment as an active participant, as a customer, if you like, is central to our judgment about whether we go ahead with it or not. I can see that there's a case for a more formal evaluation of the effectiveness of these different approaches at a later point, but we almost need to do the design work before we could test in that more formal way. So I don't see us running this in any kind of sort of structured experimental way. I don't see us running like a randomized control trial or even a quasi-experimental method. I think we're more in the design space than in the social research experiment space. Is that clear, Mark?
Mark can't respond immediately.
Great.
Oh, there he is. Good.
Who's next?
Okay, so we've got a couple of practical questions. So someone has asked a question about how much time each month will a local area be expected to give to support this work, and what's the time scales for us working with the pioneer partners? Damien, would you?
So the the question on how what's the timescales for this piece of work, again, it comes down to the individual prototype that or set of prototypes that we agree to work on in a particular site. It's probably fairly easy to conceive of one or two of these prototypes as being a very quick piece of work. And that's even if they're successful and go through several iterations, they might be over within a few weeks. Some of them will be a lot more involved. So, for instance, the outcomes framework or building the evidence-informed social work organisation might be substantially longer pieces. We've got a broad commitment to release something come November. So some form of interim report around what we've discovered, and we would anticipate that the bulk of the work will be done by then. But there may be, I don't know, just off the cuff, 20%, 25% still ongoing, and perhaps into next year.
Thank you. And roughly, finger in the air, how much time might each area give a month to working with us on this? Any sense of that? Was that really?
And again, it's the same. It's the same sort of answer, because it depends on the appetite from the site to work on multiple prototypes or just one or two. So I did see a question earlier about whether local authorities will be will be required to work on all 4 or 5 topics, and the answer to that is no. The minimum commitment is 1 topic and 1 prototype. This all needs to be brokered once we've received applications, sifted through them, and built a list that sort of works in terms of reasonable coverage of the slide that we're all looking at now in terms of the prototypes and the topics.
But just to be clear, from our side, we want this to work for you, and we want the time commitment that you collectively put into this to be justified in terms of not just the benefits that the sector will get and what work centre will get from your contribution to this, but the benefits that you will get, because we're very hopeful that in addition to it being useful for us, you will get something as participating authorities from this. And we are very open to negotiating between that range of 4 to 5 topics at a kind of sort of maximal end of things, or just 1 how and 1 what at the minimal end of things, according to what you think you can contribute and what we think your interests might warrant in terms of time. So broadly speaking, giving us some fairly rapid feedback on website design and look and feel and knowledge objects might be something that is relatively straightforward. Some of these other things might take quite a lot more time over a much longer period, and if you were only interested in participating, if you could put in a small amount of time over a short period, that wouldn't exclude you from getting involved. As I say, our principal concern here is that we get a group of authorities who are motivated to work with us in the spirit of this endeavour, and that you've actually got not just the kind of the commitment on paper, but that you can evidence that commitment by the support of your senior officers who will be behind your authority's participation in this. So that's our number one thing. And apart from that, we're pretty open to negotiation about exactly what you work on, exactly how long it will take in terms of elapsed time, and exactly what kind of resource it would need. And if we need to toggle things back to fit your constraints, then we will do that. Someone's asked a couple of questions about the relationship between phase 1 and phase 2, which I think is a reference to the stuff in the note about what's coming later in the year. Do you want to start with that, Damien, or shall I start with that?
Yeah, I can happily start with that. So this won't be the full gamut of our prototyping, co-design activities. Far from it. It's the first pass at prospecting promising approaches to supporting evidence-informed practice and helping local authorities to be evidence ready, such as when the research partner starts publishing, they will be in the best possible position to receive that evidence. That's obviously a big task. So we have what we're calling Wave 2 rather than Phase 2 that we'll be announcing later in the year. And the sort of broad conceptualization that we have of that at the moment is that it will be part a second iteration of this, so building on the promising approaches and the development that we do with the first wave of local authorities, and perhaps building on some of the more promising prototyping activities in new sites. But it will have more of an emphasis on the scaling end of things. So whilst we may look at some new prototypes, the emphasis will be less on the prospecting and more on implementation. So actually bringing the two parts of the equation that we presented at the beginning, the what's and the how's, or the evidence and the supportive conditions, to deliver successful evidence-informed practice.
So just to push that a little further and to respond to the screen's gone blank, Katrina's question about the difference in time commitment, my view is that there will be a difference in time commitment and in the commensurate level of resourcing between Phase 1 and Phase 2, because Phase 1 is much more design-driven, exploring, testing, and Phase 2, I think, is going to be more in the space of, we think that this is an intervention for which there is demonstrable evidence or promise, and we are looking to see what it takes to scale that across more than one place. So it's more like, and I think a number of you will be familiar with the work of the Education Endowment Foundation, it's more like, I'm not exactly in this space, but it's more like what they do when they say, we want to run a trial around an intervention, and so we have funding for you as participants to, in effect, pay for you to run that intervention, but you run that intervention in the context of an experiment that we are keenly involved in the design of, we the EF, and that involves both setting rules about who gets to participate and also around the fidelity of the intervention, both in terms of training and ongoing monitoring, in terms of the data collection, and in terms of the role of an independent evaluator. Now, all that stuff that the EF does, and I'm sure a number of you know this, costs more money than the kind of sort of iterative, sort of design style testing of whether an evidence masterclass works or whether a particular configuration of a website might be better or worse than another configuration. And that's why the intention is that there will be a larger amount of funding for Phase 2 activity. But just to be clear, and I hope we've said this in the documentation, participation in this current wave, or phase as it's referred to in the questions, the thing that we're asking bids for now, participation in this doesn't have any implications for your participation in Wave 2 or Phase 2 later in the year. So you can participate in this and participate in Phase 2, or you can participate in this and choose not to participate in Phase 2 or not be selected for Phase 2 even if you apply, and you cannot participate in Phase 1 and still participate in Phase 2. So there's no necessary relationship either way. But what I would say is that we are shaping our thoughts now and over the coming period about what Phase 2 will look like, and in part that thought development will be shaped by what we do with the 6 roughly authorities that we select for Phase 1. So I don't think anyone should think that if they're participating in Phase 1 that will have any potentially harmful implications for their potential participation in Phase 2. If anything, with most initiatives, if you get involved at an early stage, that normally helps shape the thing for subsequent phases and may actually lead to you making a more informed decision about whether you want to apply for Phase 2. So I wouldn't want anybody to think they've got to hold back because there's going to be a Phase 2 later in the year with some more money than the modest amounts that we're suggesting at this stage. Katrina. Is that, I see you're about to...
There's also a question I just don't know if we've covered sufficiently yet, which is about the extent to which people have to work with the ideas that we've set out in the paper and the extent to which they can come up with their own ideas.
So I tried to answer that earlier, but I'll say it as clear as I can. I am not wedded to any of the columns in this last slide or any of the ideas that we've included within the document. I am keen that we get some authorities that are committed to working with us in some as yet to be determined form on the initial research priorities that have been identified for the centre. So I hope that's clear. There are two questions about what's meant by scaling and what's I think Pauline, you might just give us a little bit more, because I think I see where you're coming from. But if you could just talk about the different organisations and the different topics and the risk of fragmentation. Is this if we're doing too many things in wave 1, phase 1, and that's not linked with wave 2 or phase 2, that we're just going to be all over the place. I mean, my sense is, if that's where you're coming from, I understand that there is a desire to get the focus of efforts in wave 2, phase 2 to come out of the priority topics that we've selected. So if we have said the two initial research priorities are what works in safely reducing the need for children's care and supervision and decision making, and there will be some others added to it, I would be very surprised if some of the focus for the scaling activity in phase 2 wasn't around those topics. I would be very surprised if we said, oh, those things that we said were priorities in May, June, we've now got a load of completely different things that we want to spend some money on. So I can't say right now how the wave 2 money is going to be spent, but I would say it's highly likely that a lot of it will be directed towards the things that we've already identified as priorities or the things that we will add as priorities. So there should be that join up on the topic focus. On the kind of sort of how focus, it's harder to say whether there's a risk of fragmentation, because the how, the column ideas are much more experimental, and as I hope I've made clear, we may end up dropping some of those ideas as a result of the work that we do with you over the next few months. And I think that would be a good thing, because if we try some ideas out and they don't work, the best thing we should do is bin them. So I would have no difficulty in a degree of development from wave 1, phase 1 to wave 2, phase 2 around different approaches, provided that it was in the light of what we learned from phase 1. Pauline's asked a question while I've been rabbiting on. Well, go on.
I was just going to say that the focus for this activity really is on the other part of the equation than the evidence base, and it's a concept that we've all struggled with throughout the early days of this initiative, but it is important. We have a research partner focused wholly on the research agenda, on building the right research priorities and exploring them in a number of ways. This activity is focused on, in the first instance, notwithstanding that each prototype will need an evidence base in order to be effectively tested, developed and iterated. But the focus in the first instance is on the how. So that business mechanism, that organisational mechanism, channel of communication, tool or service that enables evidence to be shared, generated, and for evidence-informed practice to then be implemented. And I know that's probably a bit of a repetition, but that's the first point that I would want to say in response to that question.
Okay, so I'm going to respond with some sympathy to what Pauline is saying. There's always a judgment to be made in a process of this character as to how broadly you can spread yourself before the activity becomes ineffective. Now, my view is that you can spread yourself a little bit more thinly when you're doing design research than you could do if you were doing a more rigorous form of evaluation or experimentation. Yeah. But I do agree with that I think what lies behind Pauline's question, which is that even allowing for that, we may well be trying to do too much at this phase. I'm not sure that we are, but I would genuinely be open to reviewing this and concentrating our effort on a smaller number of columns in the light of the feedback that you had. And it may be, and this sounds like it's leaving things to chance, but genuinely, you are all experienced professionals. You're looking at this, and you might all be thinking, well, I like the look of column X and column Y, but column Z looks like it's a bit not quite the thing that's going to float our boat. And then if you all reply saying, actually, we're interested in column X and column Y, and some of you might go so far as to say, and we would very strongly not want to work on column Z for the following reasons. Actually, when we look at that, we will start to compress our range of activities and our focus in the light of what you tell us. So genuinely, at the risk of repeating myself from the start, this is an ambiguous and uncertain process, and it's one in which we're really keen to listen to you. We don't have a model of how we want to do this that we are looking for lab rats to test it with. We want a relationship with experienced practitioners within the sector who, between us and you, can shape something that is likely to position the What Works Centre best for success. And Pauline's point is absolutely right. I've just seen it on the screen there. It will depend on the bids and how they fit together.
Yeah, that's it. And just to echo that, I think this is probably, you're right, Pauline, to look at this and say, actually, it's quite a spread of activity for what is a fairly small team at this stage. So this probably is right at the very limits of what we might consider doing in terms of volume and scale. And as we've said before, 6 is probably the upper limit, although not definitely the number of local authorities that we're looking for.
For what it's worth, we've had hardcore people saying you should try one initiative with one authority, and that should be the extent of your prototyping, and we thought that was going too narrow. But I take the comments and the spirit in which they're offered, and very happy to carry on this conversation through the application process and afterwards.
So, got a question for email, just to throw that one in there, and that is just to ask a question about whether a group of local authorities could work with a teaching partnership to submit a bid. This would help with the preparation for accreditation.
Yeah.
Great.
Sounds like a great idea, so we welcome a bid like that.
Yeah, fantastic. Anything on Twitter? Do we have anything coming through on Twitter yet?
I don't think so.
So can I just say we've been seeing various questions scroll up or down the chat column. It may be that we've missed a question that someone asked earlier. So if somebody feels that their earlier question that went on the screen has disappeared and been neglected by us, please feel free to repeat it, and we'll have another go. I can see 2 people typing.
Oh, scaling.
Scaling.
I think the question was, what do we mean by scaling in this context?
Do you want to start?
Yeah. It's a good question, and as you can imagine, with a project like this, a significant part of the challenge in getting off the ground is to create some form of framing device that makes sense and meets a number of requirements, whilst also hopefully making sense to people. Well, as probably the primary requirement. Yeah, I'm not surprised to hear that there is some ambiguity around it. What we mean is, I won't say what we mean is simply. What we mean is building on the insights that we develop through our generating and sharing prototypes, and on our emerging evidence base, to develop propositions that can actually then be in some form implemented in a later phase. Now, there are things that in this phase we can start to think of as scaling or playing into that sort of scaling space, including, for example, the development of an outcomes framework, which will give us the parameters for successful, or the measures, I should say, for what is successful evidence-informed practice. And of course, the building the evidence-informed social work organisation is explicitly something which is taken from local authority to local authority as an almost sort of consultative offering, and will involve. We anticipate or imagine, because it's not yet fully designed, an element of diagnostics or analysis of the particular challenges in evidence-informed practice faced by a local site, followed up by some support, both in terms of culture change, leadership brought in from outside, and the sort of tools and techniques that are developed through this prototyping activity, and indeed through other channels and other activities that we have ongoing in the early development of this initiative. So I'm afraid I can't give a more succinct answer than that. It is quite a wide-ranging bit.
So let me try and add helpfully to that. Look, can I say what I think it doesn't mean at this stage? It doesn't mean taking an intervention or a practice that has a promising or a degree of I'm going to say like Donald Trump here, provenness. So the idea that we're going to say here is an approach, and there is some evidence that it has worked in this type of authority, and we want 3 of you to see whether that intervention will work for you. That is often, and that is something that I've seen in other contexts described as scaling. What we want to do at phase 1 is not that type of scaling. What we may end up doing in wave 2, see the earlier conversation, is maybe more like that. And so there is an interesting question about the relationship between what comes next and some of the other scaling activities that have been around the sector. But I think I can say pretty clearly that we will not be taking an intervention from one of the rows. So we will not be saying outcomes focused supervision looks like it's really promising, or looks like there's a really strong evidence that it works, or systemic supervision has worked in this circumstance. We want 3 of you to try doing it at this stage. That's not what we mean by scaling. So, Colin, I like your question. Thank you for the positive response. And just to be clear, we are happy to have follow-up conversations with people if you would like to arrange one. And I think there's is it Georgia that people contact to arrange for a conversation?
Yeah, so we can take Colin's details directly from this webinar, and suggest that someone from Sky and from Ewan's engagement team gets in touch next week.
I will be in touch if that's what you want. Definitely, we'll be in touch.
And Suzanne's question about the support and guidance from ourselves, is that the support and guidance in advance of the application, or is that the support and guidance after you've submitted the application and we've agreed, or we've selected you to be part of the process? Suzanne is typing before and after. Yeah, so in advance, I think it's basically the offer that we've just made in response to Colin's question. Very happy to arrange a conversation in advance of the application process. After, I'm imagining that there will be two types of support and guidance. There will be the support and guidance that comes from someone who, within the development team, acts as almost kind of like the sort of almost the sort of the complement to the coordinator role on authority side. They're almost someone to coordinate the range of activities across the cells as represented on this last slide. So there will be teams of or there will be groups of staff within the development team in the What Works Centre and the research partner working on particular topics and on particular initiatives around generation sharing and scaling. And if we've agreed that Authority X will work on supervision decision making and work on an evidence masterclass and an outcomes framework, then the job of the point person within our team is to make sure that you are not overwhelmed in that authority by calls from the evidence masterclass people on Monday morning and the outcomes framework people on Monday afternoon and the supervision decision making people on Tuesday morning. We want to make this smooth for you, and in my experience, having it sounds like a management consultancy concept, and it is drawn from that, having someone who manages the relationship between the What Works Centre and the authority on our side will be a good thing, and that person will be providing a lot of support and guidance about the process, but obviously they will then be managing the access that you get to functional experts on the website and on masterclasses and on topics, etc. It's 3 o'clock.
So,
anyone got any last questions?
it looks like Suzanne is typing. A few of you still typing. We can stay on for a few more minutes, if that would be helpful.
Multiple attendees are typing.
Any questions? I mean, send them to ewan.king, K-I-N-G, at scie.org.uk, and I can either try to field your questions or book a call with you in the next week, because I think it would have to be in the next week, to provide some additional support and advice.
Great. Look at that.
Thanks, everybody.
And yeah, thanks, Mark. We'll happily talk to you. Look forward to it.
Thank you. Have a good weekend, everyone.
Thanks, everyone.